Pharmacists have two main challenges when they're dispensing pain medications. The first is to figure out who are the people who need the medicine and who are those who don't. And in order to do that well, they have to have a validated screening mechanism to look at each prescription to make that professional decision as to whether this is a prescription that should or should not be filled. The best practices I recommend for pharmacists and physicians to implement in order to make sure that people who need their medicine get it are to collaborate, to communicate, to cooperate. Now, it's not easy to do that. And what I suggest is that pharmacists have some sort of risk stratification mechanism so that they're not calling physicians all the time with the low-risk patients, but instead are contacting physicians for consultations only when it's really necessary because there's a high risk of diversion or abuse. There are a lot of factors that a pharmacist might look at in doing a risk stratification. The goal is to place patients in either high risk, medium risk, or low risk. So, for example, they might look at the distance between their pharmacy and the address that's on the patient's ID. They might look at the distance between their pharmacy and the address of the prescriber. They might look at the number of times in the last year that the patient has reported lost or stolen medications. They might look at the way in which the medication is prescribed. For example, an every 12-hour medication prescribed every 3 hours or every 4 hours. So there's just quite a few factors that can be used by pharmacists in making this risk assessment. One of the tools that a pharmacist can use in making a risk assessment of each patient is accessing the prescription drug monitoring program that the state maintains. Pharmacists can get a report that helps them understand the background of medication use of each patient, and armed with that additional information, they can make an informed decision about whether a patient is an appropriate recipient of medication today, or instead, whether there are some questions that need to be resolved and can only be resolved by either talking to the patient or talking to the prescriber or talking to both. If you have a pre-existing relationship with a prescriber, then it's less confrontational when you call. But it's also important to call only when it's really necessary, when it's the high-risk or medium-risk patients. There's no need to call prescribers every time a prescription is presented, particularly when it's a low-risk situation. That's just bothersome. It's also important when pharmacists have a problem to have a solution. So when you call a prescriber and say, I think we may have a problem here that we need to deal with, and the prescriber says, well, gosh, I recognize that problem. Thank you for calling me. What do you suggest? Have something in mind. Have a suggestion so that perhaps you can facilitate discussion in that way. What we seem to be doing is developing a long list of red flags, things that seem amiss, that should raise suspicions. And we're not spending as much time as we should discussing how to address these red flags once they're recognized. A red flag is simply a reason to slow down, to think through a situation, and to make inquiry of the patient, make inquiry of the prescriber, to resolve whatever the situation is that's raised by the red flag. I did some interviews with pharmacists, and I was using the phrase red flag. I was using it pretty liberally. And when I used it, it was pretty clear to the pharmacists I was talking about these stops, these bad things that could happen, or these negative implications about patients. And the pharmacist said to me, wait a minute. There's some good things about patients oftentimes. We look at patients not just because there are perhaps some problems with their prescriptions, but because there are some advantages, there are some mitigating factors, some reasons to fill their prescriptions. So with pharmacists, I've urged them to develop a list of green flags. For example, a non-problematic PDMP report. That's a green flag. We may have had a problem here, but it seems that we didn't because the PDMP report is non-problematic. It's desperately difficult for people in pain to get prescriptions filled in some areas of the country today. Pharmacists don't have product. Suspicions are raised by factors that shouldn't be suspicious. Pharmacists end up denying medication to people and not telling them why it is that their medication has been denied. That's really a problem. People who don't get medicine need to know why that is. Pharmacists are sometimes reluctant to tell patients why they didn't get their medicine because they're afraid they may be coaching the drug diverters on how to behave more appropriately so that when they go to the next pharmacy, having learned from the pharmacist what they did wrong, they'll do it right at the next pharmacy. That's really a shame. In reality, what we need to be doing in pharmacy is telling people what it is that objectively causes us to not be able to fill their prescription. And we need to be using these objective factors, explaining them to them. For example, that they live 100 miles away from the pharmacy, that their physician lives 100 miles away from the pharmacy, and that they've driven past 50 pharmacies on the way to my pharmacy. That's just an objective fact to explain to the patient so that they can understand that. They may then have an acceptable response. They may say, well, my babysitter lives here, or I work here, or this is my parents' home and I'm living with them right now, or in some way take away that negative factor. But the only way we will learn that is by talking with them. Pharmacy is a difficult profession. Pharmacists not only have to be skillful, they have to be knowledgeable, and they have to be effective communicators. And it's hard to do all those things well at the same time, particularly in a busy pharmacy where things come up, problems come up always at the worst time. So what's important for pharmacists is to be able to just take a deep breath, relax, and say, it's more important for me to get this right than to do it quickly. And it's important for patients to understand, this is not fast food. This is not where you should expect to get your prescription filled within 30 seconds. Pharmacists and prescribers are colleagues. Sometimes they've only met once or twice, even though the pharmacist fills the prescriber's prescriptions 100 times a week. And what we need to do a better job of is getting together and learning who we are and discovering that we all have the same objective, and that is to make sure that the people who hurt get the medicine that's going to help relieve the pain they're experiencing so that they can live complete lives. Also, to make sure that when there are suspicions, concerns about a prescription, we don't just turn the person away because of those suspicions, but we talk to each other and work through it. And it may be we'll conclude this is somebody who shouldn't have medication, and that's fine. But that's based on this collaborative, communicative, cooperative relationship that we have to foster between ourselves, between the pharmacists and the prescribers. What Community Connect can do is bring together people who are colleagues, who know each other but perhaps have only met once or twice, who rely on each other, who are collaborators in patient care, whose objective is to get people medicine when they need it, to relieve their suffering, to take away their pain. Now, sometimes we create problems for each other, and we don't know that we've done it. Pharmacists create problems for prescribers. Prescribers create problems for pharmacists. We don't intend to do that, don't even know we've done it. What Community Connect provides is a forum for us to get together and to talk about the problems we face together and how together we can address those, but also those problems that we're creating for each other and how to not do that, how to work together better, more effectively, more cooperatively with effective communication.